October 16, 2012. Alex, will you give a blessing?
Our dear Heavenly Father, the Lord, as the City Council convenes this evening, we pray that you would bless them, that they might have the opportunity and to fulfill the business of the city which has been placed in their hands. And those who are duly elected and chosen, may their deliberations be for that which would be for the benefit of all. And I pray, dear Heavenly Father, as we know that good government is a blessing unto the people who are served, both those who are within the City Council and those who labor daily to fulfill our needs. So we ask that all deliberations might be unto that end for the welfare and the benefit of all. And this we ask in the name of Jesus Christ, our Lord. Amen.
Thank you. Any additions to the agenda?
I'd like to have Laura Miller with solid financials. And if we can slip her in behind citizen comments. Solid financials.
Mel wants to remove number 1 under administration. And I'd like to add a 15-minute executive session under legal for acquisition of real estate. All your agenda right now. And Mike?
Take off number 1.
Take off number 1. Duly noted.
I'd like to add a city library board appointee, I guess under new business. So.
If that's a mayor's appointment, yeah, we'll have to wait until she's here.
Yeah.
So, okay.
Yeah, that's fine. I just wanted to bring it to council's attention so I can read this letter to him.
Okay.
Move to accept the changes.
Second.
Any further discussion? All those in favor say aye. Aye. Full row. Need to approve the consent agenda.
Do you want me to? Okay, number 1, approve minutes of the regular meeting October 2nd, 2012. And 2, approve appropriation ordinance 1016-2012 in the amount of $17,343.98.
I'll move it. Second.
Any further discussion? All those in favor say aye. Aye. Full row. All those opposed? Okay, Lori.
Citizens vote first.
Go ahead.
No business.
Any citizens' comments?
Didn't have anybody sign in.
Yeah, we didn't have anybody.
Okay, hold on.
Thank you.
This is my
my colleague, Christine McCune.
Hi, nice to meet you.
We're with Solid Financial out of Hutchinson. I'm actually part of the strategies, which is the investment side. Christine is part of the solutions, which is the insurance side. Although, you know, I do a lot of insurance too for a lot of my businesses where we do their retirement stuff. They've asked us to help out with the health insurance. So, in doing so, we have quite a few clients that we have been able to help. We work with a TPA firm who has been doing just health insurance for over 30 years. They're out of Great Bend, Kansas. They have a very innovative way to look at insurance as far as being fully insured, partially self-funded. They have a lot of large groups, small groups. And I'm not going to pretend to know everything about health insurance. I will tell you that first off. But we do work with a lot of groups. In fact, some of the companies that they do health insurance. We have the City of Lewisburg, City of Abilene, City of South Hutch. We just took that over. We'll start that in January. Lane County, Rice County, we take care of theirs. They're in Lyons. The City of Neodesha. And all we were looking at doing for the City of St. John was just doing not just a health review or taking your plan out to bid, because any broker can come and do that for you. What we're looking at is consulting. We actually have it's a proprietary plan design that I'm not going to take credit for. Julie Yarmer, Freedom Claims in Great Bend, co-developed this. It's called the Freedom 105. And, you know, I've got a couple of copies of just proposals, and of course this is for, you know, the groups in the 70s, so it's a lot larger group than what you guys have here. However, and it may be on the Freedom 105, typically we save our clients, and I've been doing this for and I myself have only been doing it for a little over a year with my health clients that I've brought to Freedom Claims. And with the Freedom 105 plan, we target anywhere from $1,000 to $4,000 per employee per annual year in savings. And the groups that I've put on this plan that I've now just enrolled have hit that target. So $1,000 to $4,000 per year per employee is our target. And I know you have a small group here at the city, but that's something. And it may be that typically the Freedom 105 works really well at the 10 or above, and you only have, what, maybe 6 or 7 employees?
We have 15 full-time.
15 full-time. Okay, then the Freedom 105 would be a, you know, and that's another thing is that we do health apps, just like most companies do, but we have some innovative ideas and how we take that and where we can take and put that sum in the city's control instead of sending all that money to the insurance company. Typically in a 5-year period, you're going to have 3 really good years. You're going to have 1 bad year, and you're going to have 1 good year. But you'll have 3 average out of that. And in the good years or the average years, when you have a good year, you're not going to get money back. You currently use Blue Cross Blue Shield. If you have a good year, you're not going to get a rebate back from the insurance company. Typically how that works. With the Freedom 105, the way we do that is a lot of times what we'll do is we'll build, we have like an umbrella policy. Typically $5,000. I don't know what your plan currently has. You have a couple triple option.
I don't understand.
If you have a $1,000 deductible, some companies have $1,000, $1,500. They'll have several options for, and we can develop and mirror what we do when we go in and look at a company's health insurance. We'll mirror exactly the plan that you have. So our job is not to just save the company money or the city money and reduce the benefits. It's to preserve the benefits that you have or enhance them and save money. With this plan, the company is actually able to take a lot of the control away from the insurance company and develop basically their own plan down to $1,000 deductible or $500 or whatever plan that you're trying to match or create. We'll also come back and give you several ideas of other plan designs that may be a way to save money, or if you want several options that are available to the city employees. So with that, you know, all it is a review. If nothing else, you know, you can put it in your file and say we did a due diligence. We have the best plan available for our city employees. We're saving money and we're being cost, you know, effective for your employees in the city overall. But you're also preserving the benefits, because ultimately what you want to do is have the best benefits for your employees because you want to retain employees. And that's where Christine's expertise comes in.
And I do the supplemental, which works nicely with the health insurance. You've got 3 different areas. You've got health insurance, you've got ancillary insurance, and you've got supplemental insurance. Ancillary is like, when you come to work, I'm gonna give you $15,000, $25,000, $50,000 worth of life insurance, and then you can ball up, which means you can voluntarily add to that AD&D. We do that. And then we do the supplemental, your AFLAC. I do not represent AFLAC, I am a debt killer. Not that it's a debt hunter, not that it's not a great product, it's a really good product. It doesn't matter, you know, the product is only as good as the person who's helping you with the claims. The product is only as good as you using the claims. So we do that as well, and I brought a couple brochures. I'm sorry I didn't bring as many as I needed to, but here is a flyer that kind of lets you know what we do. And there is the cancer policy and the accident policy. We took a hard look at AFLAC because, at Allstate, because Allstate went in and replaced all of AFLAC in Walmart. And the reason they did that is because apparently they have a lot of cancer in Walmart, and Allstate just has a great cancer policy. They have numbers that you have to qualify, so sometimes in smaller groups, we use different companies. Example, I use Illinois Mutual or a company called Platinum. But it's pretty much the same benefit, and it's all about the insurance agent helping you get the benefit that you paid for. So, with that being said, I will leave that with you.
And with the health insurance, all we're asking is just to give you guys a review, look at it, show you if we could save you some money. For cities, and I know a lot of the school districts and stuff like the idea of having that money, because you essentially are building your own plan. If you can take a plan, have an umbrella policy, kind of like the self-insured do, but they buy a $75,000 policy, and they have to come up with their liability is $75,000 per employee on that kind of a plan. Well, we bring it down to a $5,000 level, and then we build that plan specific to your company and your employees. You can change your generic deductible or co-payment to $5 instead of $15. You can design that plan to best fit your employees. Also, we have some colleagues that actually help us. We have a company called ServeU, and ServeU actually is out of, we have our rep is actually Lynn Dickey. You guys, if anybody knows any K-State, got any K-State fans in here? He was a quarterback for K-State, went to Green Bay. He actually works for a company called ServeU. He helps us on our groups. If we have on the prescription side, what they'll do is they'll have reports on all the prescriptions and stuff that people are taking. If they have something, what's called a generic equivalent, they'll look, and if a person is taking Celebrex, which is an anti-inflammatory, it's an $80 drug, there's no generic available, but there's a generic equivalent. There's other drugs that are an anti-inflammatory. They're, oh, by the way, on the $4 Walmart list. So we do a lot of education when we enroll a group. You know, everybody gets a packet like this. They get Julie's cards right there. Actually, that's just an example of what the card would look like. On the Freedom 105, and what we can do is we can also co-brand it too if you want to put your logo, the city, you know, or something, and actually make it specific to that company. We sit down with each employee, we talk to them, we actually can get the information from them on who their primary physician is and that kind of stuff, so they're proactive in contacting the doctors and letting them know. You know, the new insurance, because a lot of times where employees and the insurance problems take effect is usually when people don't give the new insurance information to whatever their provider is, or usually it's a lab or something, and so we help out with that as well. But with the ServeU and the help there, so we actually have a team that actually helps. They'll send letters to the employees and say, hey, did you know you're taking this or something else if you want to save some money. They can't make them take that drug, but it's a way for them to help save money. Because overall, a lot of times when you just have, if you're looking at it from an employee standpoint, you're just looking at, I'd have to pay $15 if I go get this drug. You don't, or the brand name stuff, it's $30, and you don't, and the drug costs $600. They don't really know about the other costs because the group is actually taking that, and you'll see that in your renewals. We actually also have a Consult-A-Doc. This is an extra thing. It's, I mean, you know, it's $2 per employee per month or something. It's pretty minimal cost. It's something you can add to your plan. Freedom Claims, Julie has this on all the gals in the office. It's a Consult-A-Doc. You actually put all your prescriptions, your information, you set your your stuff up one time. You can call them, you can do it online, however you wish. And it's a way for, if you have say you have a sick kid and you don't want to run to the emergency room, you can actually call in, they will call you in a prescription, you know, you don't have to take time off of work, and it's really minimal. And, I mean, this is something I would use. I have health insurance, but I never go to the doctor. I mean, I can be on my death, I have to be pretty much before I'll go in. I would rather call something in than miss work. So consult the doc is another optional benefit.
But again, what we found is really more the education. We like to, you know, the employee needs to feel special. You know, you need to retain them as employees, and they've been with you for a long time. So we're not in here coming, you know, taking over and saying, this is what you're going to do here and here. It's just more educating. And we're available. I have employees that call me when they're at the pharmacy, and they just got their bill and it was $80, and they just didn't realize it was coded wrong. So it's just having someone walk you through it, and that's what we do. We have some groups in Stafford and nothing in St. John yet, even though I love the town, love the square. Wish it was in my town. But we have a lot of groups up here, and so we're up here on a monthly basis. And if a client does need us, then we jump in the car and get here. So.
And actually, to do the actual review, typically what we gather is just a summary of your benefits. It's usually a two-page thing that just shows us what plan that you have now, and if that's what you want, you know, us to look at and quote, we get that. And then we do health statements if it's a small enough group and you can't get. Usually, on the large groups, we can get actually a couple years worth of history from the prior insurance company. That's not always easily attained. The health apps are basically one-page front and back. And then there's a one-page declination if, say, they have health insurance through a spouse or something like that. So we actually will come and pick those applications up. They do have confidential information, so we're mindful that you don't want to send that stuff over the internet or fax it. We can come pick that up. So we just love for the opportunity to throw our hat in the ring and just kind of show you what you guys can do and give you some opportunities to save some money. Thank you.
Thank you very
Any
much.
questions?
What company do you underwrite? Instead of Blue Cross Blue Shield, who's your health underwriter?
We use Allied, we use Preferred Health, we use Trustmark. We have like 5 or 6 other companies. And traditionally, especially if we're doing the Freedom 105, it's just at the $5,000 level. So, like with our groups, a lot of them, you know, statistically, they know how many people will hit that $5,000 in any group. They know if it's a bad year. We can work and have worked with Blue Cross Blue Shield, especially if you have groups that health-wise cannot get off of Blue Cross Blue Shield.
So do you mainly just cover the first 5,000? Is that what you're saying?
No, we'll use traditionally, and it works a lot like if you know anybody that's on Medicare and they use a Medicare supplement. Medicare pays primary, and then Medicare pays everything. It doesn't cover the 20%, on the B side. So then your supplement picks that up. This works similar to that in that you would have a primary card or primary insurance company. It would be the Preferred Health or the Allied or the Assurant or whoever the umbrella carrier was. And then we would have a secondary card. Basically, that would be the plan that you guys would design specific to City of St. John. And so it would pay secondary to that. And the reason we do that is because they're keeping track of all of the claims to keep track of the $5,000. And then Freedom Claims does all of the administration. You get monthly reports. We can't say who it is, but we can say what it is. And then these are the claims that we have. And then you would approve, whether to go ahead and pay those claims, whether it came out of an interest-bearing account that you had, whether we set one up for you, and then they would go ahead and remit those claims.
And those claims get submitted by whom to whom?
Okay, when they go to the doctor, they have, and this is probably the biggest pushback I would say we probably get is having 2 cards. Because people, and that's why when we sit down doing the educational meetings, we'll get from the employees who their physician is, what pharmacy they go to or whatever. And Freedom Claims will proactively contact and say, right, City of St. John is using this, and these are the cards, so that they know how to bill those. The second card, which is basically the one that you could have, where it said City of St. John, would have it'd be your RX card. It would have the co-pays and things like that. So that's what you would use when you went to the pharmacy. When you're going into the doctor, you're not going to do this every time. The first time you go to your doctor, you're going to give them your information. they'll put it in the system and you don't have to provide that every time. But that's what Christine and I do a lot for our businesses, is when we're sitting down, we're educating the employees, but a lot of times they're not listening, or maybe somebody gets confused, or so, I mean, we've actually went down, and it's not always just the employees or lack of communication, sometimes it's just the billing department. You know, we've went down, Christine's actually went down and physically went to the Hutch Clinic and made sure that their system was right and that they were billing right.
They're having a billing debacle, but you don't deal with any of that. Your doctor takes care of it, the hospital takes care of it,
It's
just like they
submitted through the
normally would.
doctors.
Yep.
Exactly.
Explain the Goodyear's getting the rebates back.
When we do the Freedom 105, you would get a monthly report. It would show you, and that's why we look at what the prior carrier rates were, and that's why when we're looking at it, you know, we look at what your current rates are, what your renewal rates are, and then we'll show you the savings that you're having every month. You'll see this every month until the next year. You're going to know. It shows you what the administrative fee and how Freedom claims bills and how we get paid. Because I know you're wondering how we make money off of this. We actually charge, or Freedom Claims charges, a percentage of savings. So if you guys don't save money, we don't get paid. So we have a vested interest in making sure that your plan works. Otherwise, we don't get paid. They charge an administration fee, and then they show you the monthly claims that are paid. Your city clerk or whoever your professional is that actually handles that would get a monthly bill, and they would have to approve the claims that were for that month. Not who it was, because by HIPAA we can't disclose that, but they would know that they had a sprained ankle or whatever. Those would be approved. Once they're approved, then we can go ahead and pay them. And all the administration is done. They're the engine under the hood that does all of this. And then it shows you how much was in prescriptions every month. And then you're going to see the management fee is actually the percentage of savings. And then it shows you the gross savings of the Freedom 105 and then net savings. But you're going to know on a monthly basis how much you're saving. And when we do it, we'll actually look at the health statements. The health statements, a lot of times we have, people don't want to get the renewal rates because they think somehow the rates that we're going to get from Preferred Health or any of the other insurance companies are going to be based on maybe slimming a couple of pennies off of your renewal. It's not that at all. What they're going to do, they're insurance companies, and they're going to assess the risk based on age, health, conditions, and they're going to be firm numbers based on it. So there's really not a lot of wiggle room. Sometimes it comes back and, you know, I have no problems telling somebody, you have a great plan, stick with it. Because I'm not going to come in and put something in that's not better for them. And sometimes it happens. But we come back and we'll say exactly, and we can calculate on there how many people would have to hit that 5,000 and how much liability is to the company and the firm that's supporting this. But the money that goes in underneath that plan, and this will make more sense if once we actually do it, because we actually get to see the illustration. But we can show you that slush money that actually goes into that savings. If you have a really good year, that money's City of St. John's money. So the next year, you guys can actually maybe decide to lower your premiums for your employees. Or, but that's actually your money. You can roll that to the next year, help out with the plan, use it for other things. But that's why I say you're taking the control. And actually, we've presented to several other companies that went to some of the new, with the healthcare reform and some updates. And they actually, after we had presented this concept, and actually we had done the presentation for them, they said they went and they were exactly talking about the concept that this is, and this is the way it's going, because too many companies can't afford to pay the exorbitant fees and just to provide good insurance, but they want good benefits, and there's ways out there to do that.
So you're compliant with Obamacare?
Absolutely, and that's why I'm not, like I said, I'm not going to pretend to know all the laws. That's what Julie's been doing this for over 30 years, and she is a whiz. And in fact, that's why she's not here today, is because we told her to stay. I mean, she puts all this stuff together, she crunches all the numbers, and she does all the administration, and she's a whiz at it. Sometimes, if the Freedom 105 doesn't work, there's, and they'll calculate, what's the liability of the company? Will it work? Because there's times where, you know, if you don't have a big enough group that it just doesn't work out. But she's got health reimbursement, health savings. She knows how to develop those and put those together with different plan designs. So there's still other opportunities to make some money and save some money and still preserve those benefits.
typically the group I have he's got 47 employees, but only about 20 are on it, and he's probably saving between 15 and 20,000 a year from what he was saving. But again, education has a lot to do with that. You know, I didn't know pharmacy, I didn't know the pharmaceutical drugs before I got into this industry. If I go down to the pharmacy and I get a brand name drug, I didn't realize that full retail cost goes up against my insurance. And so again, just that education, if I can go to $4 Walmart, or again, that's where Serviu came in, where Lynn Dickey comes in. And they basically say, hey, this is what you're taking, you can take this, you can take that. So it's not just one thing, it's all sorts of little things that make it work. And it's been really successful.
Any other questions?
As we approach our renewal date on our current contract, how much notice would you need to give us a quote?
When do you renew?
April.
January 1.
Okay.
I thought it was April 1.
No, January 1.
We did a 45 life group in about 3 days. I don't want to do that again. But I mean, we can get quotes back pretty quick. But I will say January, because there's so many companies that are on a January 1, it does take longer. So you only have 6, no, you said 15.
15 full-time, they're not all on.
It really comes down to how quickly I didn't bring the applications, how quickly your employees could get those applications filled out and come back. And typically what Christy and I will do, we'll come down, and we have done it, we did it for the city of South Hutch. We went and sat down when we received those applications, instead of just getting them in a pack from the main receptionist. We sat down with each employee and just made sure that, because a lot of times they'll miss information, and then it's phone calls to the employee to try to get the rest of that. And that's usually what the longest thing is. So we can actually come in and sat down with them and help, if you guys want that. But we can get quotes back.
I was just going to propose we put you on the agenda for the first meeting in November. Hopefully we'll have a full council and we'll move to have you give us a quote.
If I can, and I don't know who I would send those to, or who we would contact to get those, would that be you?
Yeah.
We would have John contact you.
Okay. I can email you the applications tomorrow and a few pieces of information that we need, and if we could get that back, we may have something that we could show you.
Is there any waiting period for pre-existing conditions or anything like that?
On the pre-existing, that's what having the bill shows, that you have credible coverage. They're looking to make sure that you came from credible coverage. The only problem that comes from is when somebody doesn't have health insurance and they're getting on. But as long as they're coming and they were already on them, they already came from Blue Cross Blue Shield, and they would just roll to the new plan.
You might call the city of Stafford on your way through Stafford someday.
We're working on that.
Yeah, we were. In fact, that's how we got. Troy was talking to somebody there first, but.
If you have any coal, I can leave you a card.
Talk to the city clerk.
No, but yeah, so if you just holler at me, then I will, I can get you those applications tomorrow if we get started on it. So, anything else?
I don't think so. Bob?
No? Other than I'm sure when we see a quote.
Yeah, we'll discuss it on November 1st and ask for a quote at that time.
Okay.
Okay, then we're going to have to let her have some information before that.
Yeah, we got that one back.
Okay.
We appreciate all your time.
Thank you very
Thank
much.
you so much. We appreciate your time.
Thanks for coming. Yes, ma'am, for your time.
Thank you.
Hopefully,
Yeah,
look
thank
at it
you.
on the break.
Yeah, Troy has some questions.
Citizens comments, fire department, Mike Sanders.
I don't have anything.
Says you have a fire chief's report.
Yeah, but you removed that. Oh, no, let me explain the reports on here. Just so that if we have FYI stuff to give to you guys that's not an agenda item, this would be a time that they could say, so that's gonna be a normal thing on here, whether, then they can say whether they have something or not.
Just for last minute items.
Just, things that are not things that you're gonna take action on or anything, but, okay, this came in, make you aware of it, since you're all here at the table and you know it.
Okay. Any questions for Mike? Police Department, Adam Saylor.
Well, I have one executive session. If somebody else requests one, we can do it first, or mine first, doesn't matter.
We'll do yours first.
Okay, I'd like a 15-minute executive session for non-elected personnel to include Don, Jonna, Officer Rudy, to discuss the scheduled items from last meeting.
So moved.
Okay.
How long?
15.
Now, do you have any police chief report?
Nope.
Good. Thank you. On to Mel, administration.
Okay, what I have is ordinance 1015, amending the zoning regulations. What this is about is when we brought on the new regulations, the planning commission kind of decided if there was anything that they wanted to change, they weren't going to be afraid to bring it up and go through the process to change it. And what we were seeing is that there's a lot of instances where houses in town were, naturally built before any zoning was put in place, and we have it all different setbacks as you go down the street. Somebody wants to add something on to the front of their house or build out a little bit. What you run into is they have to come and get a variance to go by the existing zoning ordinances we have now. This changes it to where you can build out to the widest or the closest to the street of any building along that particular block. In other words, you've got houses that go in and out like that, and someone wants to build out, and they may not be able to under the current zoning regulations without getting a variance. So this just simplifies it, and it's not going to put anyone out any farther than the closest one to the city street, but it still requires them to be at least 20 feet out. They're going to add on something that would cause a car to be parked in the front of the house. You still have to maintain the 20 feet, and it won't affect the vision triangle. So that's what that's about. So I think, Kevin, does anybody have any questions on that, or?
Say they want to go further out than any house on that block, and they'd still be within the 20 feet and all that other stuff. They could still go get a variance, correct?
Yeah, they can still apply for a variance. All this does is keep someone from having to go through the variance process on something very simple like putting on a front porch or something like that, and that's what kind of brought this about. So it just makes it a lot simpler. I mean, 99% of the time the planning commission is gonna grant it anyway. It makes it simpler, quicker for everybody. It's not gonna do anything that would cause an issue with anybody. So that's what it's about.
Would have Weber fell under this deal?
That's what brought this whole deal about.
If you want to move to approve, move to accept the recommendation of the planning commission to approve ordinance 1015 and direct the clerk to publish it.
Don't see any harm in it.
I don't either.
I say I'll make a motion to go ahead and accept the advice of the board, or however you want to word it, or it should be
Just
worded.
like he said.
Yep.
Sure.
Roy, any further discussion? All those in favor say aye.
Aye.
All those opposed? Well. You want that back?
I've got one.
The next item has power plant equipment testing. We're inspected by our insurance, traveler's insurance, MC on our power plant equipment down there. And actually what they're trying to do is prevent a loss. So they are making recommendations that we do periodic testing on certain things at the power plant. I knew this was coming up, and John and I worked together to encumber some money, so we could have this money available to help pay for this. We've already done the thermographic survey, and actually the company paid for that. They sent a guy out with a camera and did all of our, had the engines running and everything, all the electrical stuff, and looked for hot spots and everything, so that's already been done. They're wanting crankshaft deflections. They're wanting us to do all of our engine shutdown devices, make sure they're operating properly. I don't have all the, Caterpillar has not come back with their costs on this. I do have the price to do the Fairbanks Morris OP and the Cooper Bessemer engine. So I do have the numbers on that. Next year, and that's the only time they could schedule it, is they're gonna, Mid-States out of Salina will come in and do some relay testing and check our polarity index on the generators and stuff like that, and that's, I'll bring that probably toward the end of the year, or if we have some money left over, we can go ahead and encumber that to cover it out of the power plant budget. So
Is some of this testing something, I mean, we can do? I mean, you're just, part of it, you're just testing a simple Murphy 119.
well, some of this, as far as the testing on that, I'm not really familiar with the Murphy 119 deal, but these have heat sensors and pressure indicators, and they have to simulate that to make it shut down. Some of this on the Cooper, they're going to have to install some fittings and stuff like that to get this done. Yes, I think once we can do this or see this done, they're getting more and more strict on this, and the people from the companies that the companies or insurance companies are wanting this done more and more, and just, I even asked a question to the insurance company. I said, well, what if we don't do this? I mean, it is a recommendation, it's not a requirement. But he said, we can choose not to cover you for a loss or choose not to insure you for this. So they've kind of got you. I mean, they want you to do this, and if we don't, if we have a loss, they say, well, we recommend you do this, and you didn't. But we will do everything in our power to try and make it so we can do it ourselves. As if we have to buy some equipment or whatever, and that way, some of this on the testing for the generators and stuff like that, we don't have the equipment, and probably wouldn't be feasible for us to buy it. But a lot of this we can. But as far as the crankshaft deflections, all of that needs to be done by somebody that's had training to do it, not us. So anyway, so to get to the dollar amount. And honestly, on the Fairbanks Morris, the guy that comes around and does that, he's very knowledgeable. Really, I'm going to hate it when he retires, because he's so good at this. And but anyway, he's going to check some other things for us while he's down there, so it may not be this amount. But together, to do all the testing and what I went over, excluding any electrical on the generators and not including any CAT prices yet. We're looking at $8,960 to do that.
And we encumbered
We encumbered $13,000.
some last year.
And this isn't the first time we've done this. I mean, we've done this before. So.
Usually been about every 3 years.
Yeah, 3 years is, and a lot of this, the crankshaft and stuff like that, the deflection and testing, the clearances there. We usually wait for a letter to ask us to do that, but it is 3 years on a lot of this other stuff. But they like to see you do it every year, but we run such low hours, but when they send the guy around, he sends out a letter, that's usually when we schedule to get it done. So.
All I can suggest to you is that after the fire at Stafford, you sure don't want to not have insurance, because it saves the rears of the.
That's where your testing certificate comes from for.
We send, whatever they come up with, we send a copy of the test results to the insurance company. They ask for the results of the test. So.
The insurance company isn't asking for this test?
Yes.
Okay.
Yeah, they're the ones just asking.
But on top of this, we're going to have another motor test.
Yeah.
And all the electrical.
Right. The electrical on the.
So, offhand, total bill.
Okay, we're looking at about almost $3,700 from Mid-States to do that, and I don't know what the Caterpillar. I've been after them. I've talked to them 3 times. I still can't give them the price. But.
So we're talking every 3 years, $15,000 to $20,000 worth of tests.
Well, let's just say let's say Caterpillar charges us, $3,000, and so you want to add 7 to 9. That's
15,600.
somewhere into there. And the cost of losing a generator and not having it covered, I mean, what was it, about 800,000?
Yeah, their insurance claim with Stafford is over $800,000.
It may sound like quite a bit, but you spread that out over how many kilowatt hours, you know, power and everything, so.
And that was one motor and one generator, plus the building loss. I mean, they had to redo the building, but it doesn't take long. And replacement motors, start at 400,000, and to get them installed, you're probably at 800,000 for a self-contained cat unit nowadays. Last bids we had at Stafford for a 2,000 kV cat motor. We tried a used one where they had about 390,000 on just the motor, or self-contained motor to sit outside. But by the time you wire everything up and do all the testing and everything, you got to add about another 200 to 300,000 to do all the things they have to do. I don't know if they have that much to do down here, but you'd at least have a motor plus the wiring to get it hooked up in your system, and that wiring jobs are very expensive because of all the big wires and the transformers and relays.
So, do we want to move to approve without Cat's bid? Or wait?
What? Could I say something?
You bet.
Okay. The Circle J diesel repair, who can do the OP, can do it on the 30th if I get approval tonight. I mean, or we can schedule another time, but he just said, I asked him, and X-Line out of Salina can do the Cooper probably within the next 30 days. He said maybe within the next 2 weeks if we get approval.
So if the Cat is over 3,000, you're going to have to bring it back to us.
So, so 2,000.
Yeah, that's what I meant. Move to approve. Second. Any more discussion?
So let me understand exactly what you're approving, what he's presented tonight.
Yeah.
The total up to $8,960, and it may be less if we can do it or don't, you know, it's an hourly type thing on some of this, and if they don't do all this, especially on the Fairbanks, it would be.
Any other discussion?
Is there a way we can contact them and see what fittings some of that can have, that we could do that when, you know, without paying them hourly time to either screw in a T or whatever?
I think what they're gonna have to do is and I actually, their first price they gave me was another $3,000 on top of what they charged, and I said, man, what's the deal here? And I went through them and I told them, you know, we've got prints and all that stuff, and so I basically got them to whittle quite a bit down. So, and once we see, I mean, most of the stuff will be put in line and it'll be there. It'll be a matter of hooking up equipment and doing testing. So I understand your concern, and we will do everything we can.
Well, if we've had to
duplicate
do
it.
this every 3 years, what's different this 3 years than from the
Well,
last 3
last time they apparently, you know, there was a lot less than that, and the Fairbanks was done. All the safety was done on that. The X-Line, when they did the Cooper Bessemer, they did the overspeed, and we didn't do as far as we did this time. But this time they specifically, I mean, they wanted all the safety operations shown and all that stuff. So I honestly think that we can do a lot of this ourselves. It doesn't have to be done by someone else, but until we actually go through the steps.
Well, I understand. I was just wondering if there was, you know, if just a call ahead couldn't save us 3 or 4 hours of their time.
I'll be glad to ask them.
I mean, like I said, if you're just putting T's in oil lines and
Right.
fuel lines and other stuff, I mean, I would think that'd be something we could do.
We can definitely do that.
So all of this testing that's come about now is different than what it was 3 years ago.
Well, not necessarily. It's more extensive on the Cooper. It is.
Why wasn't this stuff put in 3 years ago?
Because we didn't have that. We didn't go to that length of testing on that. We did the overspeed and crankshaft deflections. So but this time it's gonna be even more expensive because we're doing more than we did last time. And I think, once we get this thing set up, I'm hoping we can do the lines ourselves, other than cranking wood. That would be my plan.
Any more discussion? All those in favor say aye. All those opposed?
Thank you. We'll do our best to save on expense.
Thank you.
Okay, and I have nothing else to report.
Any questions for Mel tonight?
Mel, I just want to say thank you for picking up that sign.
You know, and I've asked the guys, and we don't think that came from that road.
Oh, really?
Yeah. So I don't know where it came from.
Okay.
But yeah, we got it, so
Okay,
we put it
good.
in our inventory.
All right.
Thank you.
I've got a question. Which well did you take your last water test from?
In regard to,
September's nitrate letter.
well, the requirement, we do the ones that we went over on. We do the east and west well. We do a yearly on the north well because we're not on increased monitoring. So the west well was the one that was delayed.
So you shut it off?
No. Well, we don't have to because we've notified people. We rotate them around, but it still doesn't take away the fact that it's still there. So.
But you could go fire it. So
You
could fire it.
We've done that in the past, and that's what we do is we rotate them out. So. But there's nothing to say that, like I explained at our meeting over there, there's nothing that just because the east well was below 10, it doesn't mean that next week it's going to be over. So everybody needs to assume that.
Yeah, what was, you said 2 tests?
Yeah, there's 2 tests. It was 9 or 10. It was under. So it might have been a little less than that.
But the west one showed up at 11?
Yeah.
And then you have to retest that in 2 weeks, is that right?
No.
Well, I thought if one came over, you automatically retest it.
That's if you've never had a problem before. They did that on that north well one time.
Okay.
That was just.
Well,
Just-
I thought every time one came over, then you
No,
had to
just
wait
on
a
that
certain
one
amount of
time.
time.
Once you go on increased monitoring, you're there, unless you
Okay.
go for a period of time and don't go over. And I'm not sure what that is, we haven't done it yet. But for example, the north well, it went over one time, and so before they went on increased monitoring, we tested, they sent back another bottle, we tested again, it was low, so that took care of it. Had we went up high again, then we would have probably went on increased monitoring. Yeah, the west well was 11 and the east well was 7.7.
Any other questions? Moving on to John administration.
In your packets, I had included website bids. You guys had asked me to get a few for you to look at. I went out on the city clerk's listserv and asked other city clerks who they used, and I had several recommend these two of them here. Called and visited with some of the city clerks, and they had actually come off with another company that I had contemplated checking into, and they said they had gotten so high, it was way higher than these two, so I didn't see any reason in actually getting with them. And then we have a local person who submitted a bid as well.
I have one question. Did we vote on this, or was this under consensus?
You guys told me
Nothing's been
to
approved.
get bids because you didn't like what was up now. So that's gonna be.
So this is the only bid you got?
No, I have
there's
3
two.
bids
There's
there.
three.
in your packets. There's Spinnaker, Reflective Fruit, and then Laura's.
Okay, if we do decide to change something, or we decide we wanna change something, legally, don't we need to advertise it?
Yes.
And put bids out for this, instead of just kind of behind the scenes here? Let me ask you for bid, let me ask you for bid, and nobody else gets a shot at it?
I don't know that, I don't think you're required to bid. Third-class city does not have to bid. But it's a good public policy to submit bids. So, I mean, I think that's always been, I mean, there are some times when you have emergencies or whatever, and we contact a contractor to do a repair, we don't go and submit bids. Sometimes do that because we have to do that.
Right, well, I understand that.
And so, third-class cities are not required to bid, but from a public policy standpoint, it's usually good to bid things out. That way everybody has a fair shot.
Right.
Yeah.
But you need to have, enough specifics in your bid that they know what they're bidding on.
Right.
It's probably for a bill like this, it would be called a request for a proposal rather than a bid. Send out, and that's basically what she's done, is send out a request for a proposal. So that's different than a bid. You don't have to accept the lowest bid because it was a request for a proposal. So you have, it's, you know, so there's no obligation that you take one or any of them, or you can ask, go back and have any of them.
Right.
Was
Was
the guy that's been doing it, was he told about it?
He had indicated to me at one time that he wasn't interested in doing any other design. So, you know, he's had the minutes and everything, so I assume, you know, that he would know about it. If you want me to go advertise in the newspaper and see who else we have here, who all do you want me to advertise at? Great Bend, Hutch, Wichita?
I'm not saying I do, I just wanted to make sure we weren't
Yeah,
crossing into a line that.
Does sound like a good idea, though.
I
I would like to see that happen. I would like to see us advertise for this.
And what is our current cost?
Very minimal,
Very minimal.
yes, very minimal.
Okay.
It's $300 a year, I think.
Yes, and 100 of that's for a domain name.
Yeah.
I think it's a little more than that first
Yeah,
time,
he
but
uses IX,
it's not.
I think, which I was
Yeah.
using, and it seems like it's around 120 a year, gives you 3 site locations and a domain name or something like that.
But, yeah, I would have done it that way if I had been,
Well,
Instructed at
the reason I asked, I just didn't know if for some reason we would take action if we would write in to do so.
so where do you want me to advertise?
St. John News, Great Bend Tribune, Pratt, Stafford.
Is this consensus of the council?
Oh,
Does St.
How
John
much
pick
do you
up
want to
crap?
spend up on
Yeah, we
advertising?
could do combos with us in Tioga County.
yeah, how much is it?
Since they're in Pratt, we do a combo ad.
Yeah.
I don't know, Hutch probably gonna reach more than, if you really wanna get out, Hutch is gonna reach probably more than, you know, if you wanna get out of the area, you're looking for somebody, I mean,
Then add Hutch to the,
I guess if my concern on doing it is if we were gonna do it, is that we get anybody local that could do it or would want to do it. I'm not necessarily worried about going to Kansas City and trying to find somebody to do this.
yeah.
I mean, I'm more
They're
worried about that
specialized,
everybody
though.
local in our community
Yeah,
that lives here has a chance if that's what they wanna do.
Mhm.
So I mean, I would say maybe do his, just cover the Pratt and his conglomerate deal or whatever.
Yeah, that makes sense to me. That doesn't, that's fine with me.
is that,
Like I said, I mean,
Pratt
then we're
and St. John?
spending a fortune
Yeah,
advertising,
goes up
and we're not
I
even
agree,
interested in.
if it's something that can be done locally, then by God, let's do it.
Yeah, if that's what we wanna do,
just
then let's
hang
do
on
it
to them and
local.
I'll
Right.
get, if I have any additions, I'll give them to
But you
you.
need to give everybody a shot.
Absolutely, absolutely.
I think we need to.
they used to have a Kansas thing that hit about 100 newspapers.
Just put
What's
them in
that?
your packet and save them, I'll throw them away.
That's actually not a bad way to do for
And that way I don't have
somebody.
to,
All these bids?
Just,
Well, we can contact them and tell them that we're actually wanting a proposal, not a bid, a
Right.
proposal.
Right.
And then if they wanna change them, they can change them. If not, then we have them. Wouldn't that be fair enough?
if you want to
I
turn it
mean,
down, I think
if Laura doesn't like this and she decides she wants to do something different, she could turn something else in, or she could keep this, whatever.
Right. I'm just saying that, yeah, I guess if you're price shopping, you need to turn those bids back in.
Yeah.
Yeah, I don't know that we are price shopping necessarily.
Whoops, just the bids.
Yeah, I don't care.
I didn't want to be rude and yank them out of your hand.
Okay.
That's all I had.
No first report?
Oh, wait, I do have a little thing. This came on, in my email today from the league. And it's asking, it has, the bottom one is an email from the league, deputy director, and then the second one is an email from a person who's on the strategic planning committee, encouraging you guys to go to the website that's right above Kim's name. Actually above the thank you, and over Kim's name at the bottom here.
Survey monkey.
Yeah. Mhm. And go in, they're looking for feedback from all of you folks, and it's very important for them to get their direction from you guys, if you can take some time to go out and do that. Usually their surveys do not take very long.
Yeah.
Fair enough.
And if you want to use the computer in here, we've got one that's not connected to the network, so we can pull it up, and
Can you just run a copy of the survey on?
it's,
It's an online survey.
yeah.
Body.
But come in, we can pull it up and you can answer the questions and I'll submit it. Okay. Dawn, you want one of those two?
I got emails.
Oh, okay. And other than that, that's all I have.
Any questions for John?
Have you spoken with Ron Colbert regarding our website?
That's what we were just talking
I
about.
know, but has he contacted you with
No.
anything?
Uh-uh. And now, I did have an email this afternoon, and I replied to it, you know, indicating that he had indicated at one time that he didn't want to do any other design.
Mhm.
If I was wrong, to be sure and get back with me.
Mhm.
He hasn't yet, but maybe he hasn't got the email either,
Okay.
so.
The reason I'm asking, I have an email from Ron right here, and this is kind of, well, let me just read it and you make your own decision. On the website, see that website bids are on the list. Please send me the request for proposals that was used. I will be terminating my association with the website effective December 1st and will send the authorization code to whoever the council chooses at the time. Please forward the amount of $100 to cover the operation of the website from August 1st to November 30th. Please thank the council for the opportunity to serve. Also, please remind them the existing site will disappear on December 1st. If I may be of assistance in any way, please feel free to call me. Ron.
And I responded with, I don't think we would have anybody up with the new site by, so we have some communication still to consider.
Anything else? Thank you, John. Legal, Don Matber. Do you have any reports?
No report, but you want an executive session, I guess.
I would ask for a 15-minute executive session for acquisition of real estate. To include council, Mel, John, and Don.
So moved.
All in favor? Since we're gone. Mark has requested we put the city library
Board appointee?
board appointee
Yeah,
for
I
the
agree.
next meeting. Oh,
No, for right
The
now.
mayor's not here.
Right.
Yeah, I just wanted to read this letter.
Okay.
Just so, because this is from
Mrs. Snyder, and just, she wanted the council to hear this tonight, but she understands that the mayor needs to do this. So, to Mayor Osborne and St. John City Council, the City Library Board would like to thank and commend Helen Holman for serving on the Library Board for 2 terms. We also recommend that, and ask that Mayor Osborne appoint Trish Coleman to this position. Thank you, Christy Snyder, Library Director. So, she just wanted me to pass that on to you. So. And if you could pass this on to Mayor Steinmetz. Okay.
Thank you. Anything else we need to add to new business? Old business?
I'll make a motion to adjourn.
Second.
All those in favor?
Aye.
All opposed?
Do you have something else?
Meeting adjourned.